study, we are looking for the reason and the mechanisms why alcoholic liver disease occurs. Of course, when people drink alcohol, not everybody gets liver disease. Only 10 to 15% of heavy drinkers develop liver disease. 8 out of 10 do not develop it. So this is a mystery. Nobody knows exactly why. Certainly there are genetic backgrounds, and we were focusing on a little molecule which is called cytochrome P450-2E1, which belongs to the big family of cytochromes P450. They are very important in the metabolism of xenobiotics, of foreign compounds, of whatever you get from food or from the air pollution and so on. And they are also responsible partly for the metabolism of alcohol. And when this cytochrome P450 metabolizes alcohol, then radicals, very aggressive intermediates occur, which can attack protein, which can attack DNA. And that is actually the background. Not everybody who drinks alcohol heavily increases these cytochromes. Some people develop a high increase over weeks or months with the cytochrome, and some do not. And we believe that those who develop that increase in cytochrome P450-2E1, they are bad off. They have a condition which leads to severe fibrosis, cirrhosis, and to alcoholic liver disease. We looked at cytochrome P450-2E1 in almost 100 patients. They were biopsied, and then the liver, we looked for that. And we looked for their status with respect to fibrosis and DNA lesions. And what we found, there was a tremendous significant correlation between CYP2A1 induction in these biopsies and the occurrence of these DNA lesions, which are very carcinogenic. So I think this is one mechanism, and we have published other data before. That's one mechanism which contributes to the increased risk of cancer with respect to chronic alcohol consumption. And probably not only with respect to cancer in the liver, but also with respect to other targets. And you probably know that if you drink alcohol heavily, you have increased cancer rates in the upper digestive tract, in the esophagus, in the mouth, but also in the breast, female breast, and in the colorectal, the large intestine. So we have a lot of data pointing that these DNA lesions, due to the CYP2A1 induction, are responsible for that cancer. There are other factors, there are other reasons, but this is probably one. The second finding of that study was that not only the correlation between CYP2A1 and the DNA lesion was significant, but also the occurrence of fibrosis. And you may know that fibrosis, an increased collagen production, an increased fiber production in the liver, is the prerequisite, the precondition for cirrhosis. So if you have an increase in CYP2A1, then you have an increased risk to develop fibrosis. And this is shown for the first time, not shown before. It has been shown in animal experiments, but not in humans. We think yes, if we inhibit CYP2A1, which is induced by alcohol, if we have an inhibitor for CYP2A1, then we can inhibit the sequence of fibrosis and possibly cancer. Now, it's very interesting. In Germany, there is a drug which is called clomethazole, which is used routinely for detoxification of alcoholics. This is a central acting drug, and the alcoholics get that for 7 to 10 days, and then they are off alcohol, and this is the way to detox them. Fortunately, and this was an accidental finding of our group, this drug also inhibits CYP2A1. That was an accidental finding. And it's the only, so far, the only CYP2A1 selective inhibitor. And now we're doing a study which is presently on the way, already started, a study where we give patients for detoxification this clomethazole as a CYP2A1 inhibitor and compare it to diazepam, which is another drug for detoxification. And we compare that, and we'll see if those who have the clomethazole, the CYP2A1 inhibitor, do better with respect to the liver after a while. We are in a good position that we, in our unit, we see a lot of liver disease patients, but we also see patients without liver disease who come for detoxification of alcoholism. So we see the broad range, the high heterogeneity of alcoholic liver disease, very mild, moderate or severe, and this is the big advantage for studies in our center. Usually in some centers you only see the severe liver disease because I have hepatologists, and the very light, they see the psychiatrist. But we have both, and that's the big advantage. And we see who is actually on risk. We see them very early and can follow them and see what are the risk factors. Genetic risk factors, we do now at present a worldwide GWAS study with our Australian, French, British and American friends. It's a huge study, probably the hugest study ever done. Dr. Seitz from Australia, from Sydney, is the leader of the study, and the PI, the principal investigator, is Dr. Morgan from Los Angeles.